Cases are climbing, hospitals are short-staffed and overcrowded. We've got talk of boosters and vaccine mandates swirling. A lot of new information day by day. I want to get to our medical expert, Dr. David Winter from Baylor Scott White Health. Dr. Winter, do we have him? Oh, yes, we do. Okay, I was going to say good to see you, and I looked at my monitor, didn't see you, but good to see you now. So first off, COVID-19 hospitalizations, are they continuing to climb in your hospitals, for instance, or have they peaked already by this time?
Unfortunately, they're continuing to go up. This has been several weeks now, a steady increase throughout Dallas County. A little bit of a decrease in our hospital this morning, but we think that's an aberration. We think they're still going to go up. Very unfortunate right now. This is a big deal. A lot of cases out there. Now, I'm seeing a lot of folks in my practice that have been vaccinated with mild cases, but it's a different story. If you haven't been vaccinated, I've got a chart here that shows the fact that almost all of our cases in the hospital are unvaccinated folks. In fact, we have so many, we are full right now. We're having to cut off some elective surgeries. We're having to jockey around, send some people to another hospital where there's a couple beds. We're about to run out of room from all these sick people, and most all of them, Sonia, are unvaccinated.
And what is your advice when it comes to these booster shots? Do we all need them? Can antibody levels help us decide this? Clear this up for us, because I think there was a lot of confusion. I mean, look, the way that the messaging rolled out, it was highly complicated, depending on whether or not you're immunocompromised.
Yeah, it makes sense that we'll need a booster shot sometime. I'm not sure we know when that is right now. I've seen some folks with low antibody levels that get sick with COVID, they've been vaccinated, and they have a very mild case. So even the antibody levels don't tell us what to do quite yet. The current recommendation is 8 months after your second vaccine of Moderna or Pfizer, or if you're immunocompromised, get one right away, lives 28 days past the second shot. That's the current advice. It could change next week, could change next month, so stay tuned.
So I know I've asked you this question previously, but louder for the people in the back, right? So those of us who are vaccinated, we're hearing about breakthrough cases. We're hearing about, well, they've got mild symptoms in these cases. So what do we do right now? Do we stay away from crowds? Do we wear masks? Could we go to outdoor concerts? Or how contagious is this when it comes to being around someone who might be infected if you are vaccinated?
Sonia, this new Delta variant, which is the predominant variant throughout America right now, has changed the whole situation. Before this, if you'd been vaccinated, had some mild symptoms, you probably weren't going to spread that. But this virus spreads so rapidly in your own throat. If you've been vaccinated, you may not get sick, but for the first 2 or 3 days, you have so many viral particles there, you can spread those unknowingly. So yeah, it's highly contagious. I've gone back to wearing a mask wherever I go outdoors right now. I'm worried about this. Not worried about getting sick. I've had a vaccine, but I don't want to have to quarantine for 2 weeks, and I don't want to spread it. So yeah, this new Delta virus has changed the rules of how we want to react to this pandemic.
Yeah, it certainly has. I've been eating outdoors only, and in 100 degrees, it's not comfortable, but I'd rather eat out than not. Okay, Dr. Winter, so we've been talking about the Pfizer vaccine lately. It's received full FDA approval at this point. So how does this really change things?
Well, I hope it makes people more comfortable with it. Early on, because of this pandemic crisis, they took a little bit of data, the FDA did, from Pfizer and said it looks like it's good, it's safe, but we need more data, so we're going to give you emergency authorization only. So Pfizer's continued to look and study, and they sent a lot of data in, and they studied this very carefully, like they do with all new drugs, and they found that yes, it is the right dose, it does work, and it is safe. So now it's approved like any other prescription drug. We think Moderna is right behind them. They should be approved also. So this gives more credence to the fact this is a very good vaccine that is safe for all of us to receive.
And Dr. Winter, finally, I've got one viewer question for you. I don't have a name from this person, but they say, I received the Moderna vaccine in December, January. I'm interested in a booster. I asked my pharmacist about availability. They only offer Pfizer. Pharmacist told me it's okay to use the Pfizer as a booster despite receiving Moderna in my first rounds. This is a great question. What are the latest updates that you can tell us for the public?
Yeah, the common advice now is if you can, get the same one for your second shot or for your booster shot, but if you can't, get the other one. They're made by the same technique, talking about Pfizer and Moderna. So it makes sense you would get one or the other. So ideally you'd get the same one, but if you can't do that, get the other one. It's safe to get that booster shot wherever you can find it.
What about the folks who took Johnson & Johnson? Because I know I'm going to get a question about that now that you said that.
Yeah, that's a very good question, Sonia. I don't know the answer to that. We think you should probably get another Johnson & Johnson, although they are in short supply now. So my advice is if you need another shot, I'd go ahead and get whatever you can. Even there, the common advice right now is get whatever you can get. The science hadn't quite caught up, but it doesn't make any sense that you couldn't get a Moderna or Pfizer if you had Johnson & Johnson for one shot some time ago.
Okay. Dr. David Winter, thank you as always. Appreciate it.